keeping on theme with this concussion topic this month, we're going to talk about how concussions can affect your vestibulo-ocular system, which is a really fancy way of saying balance and eye movement. I'm Dr. Sarah Swall of Resilience RX, and let's get started. So last week we covered the physiological component. Today we're covering the vestibulo-ocular component. So with concussions, some people report dizziness, balance issues. Usually this occurs on a more subtle level. It doesn't always occur on an extreme level, but people can also report symptoms with eye movement. And this can be a little bit more confusing because it's harder to differentiate and most people just think they're getting tired more quickly. So some examples of symptoms with eye movement are difficulty scrolling on a computer, like if you have a big PDF document and you're constantly scrolling through it, or if you have multiple monitors and you're looking back and forth between those monitors. Those are two different examples of how the brain processes eye movement and how things kind of come together. So it can be difficult to process vertically or horizontally or both. And there's two main things that we look at. The first is called saccades and the second is called the VOR, which is just the reflex on how your brain interprets your eye movement. So for this, to test and see if they're bothering you, two options. One, you look straight ahead and you turn your head side to side. Really quickly, goal is going to be about 180 beats per minute. You kind of feel like a bobblehead a little bit in a ways. You're also going to test up and down. If that reproduces your concussion symptoms, then you are having difficulty with some of that eye movement and the processing. The other thing to do is to stand about 1.5 feet from a wall. You're going to have two targets on that wall and you're going to look back and forth between the targets while your head stays stationary. So this time your head is staying stationary while your eyes are moving. Last time your eyes stayed stationary while your head is moving. And this can be really challenging in some individuals who struggle with concussion symptoms to have that brain process that eye movement correctly, because there's a bunch of neurons, or not neurons, sensors in your muscles that tell your brain where your head is in space. And that information can get kind of messed up after a concussion, which is why doing things like going upside down, doing somersaults, if you so desire to do one, or a cartwheel can be very confusing and very challenging. There's also something called visual motion sensitivity, and this is when objects coming towards you or objects moving around you can give you symptoms. So for example, you're sitting in a car. I struggled a lot with this after my concussions. We're on vacation, we're driving through the mountains. That visual change of watching the scenery can mess with your brain after a concussion because your brain doesn't really know how to process it. It's lost that ability and it's really struggling. And that is tested a little bit differently. You hold here and you turn back and forth about 50 beats per minute, 80 degrees each side if you want to get really technical. Looks kind of silly, but if you get concussion symptoms or your symptoms get exacerbated with that, that also indicates a deficit in your brain's ability to process that visual information from your eyes or the inner ear information from the vestibular system. So that's fairly in-depth, but it's a quick overview of how the vestibular ocular system can be impacted with a concussion. So if you're struggling with sensitivities to eye movement, to scrolling on a screen, and you've had a concussion, odds are those symptoms never got fully resolved, and they can. And if that's something you'd like to talk about, feel free, shoot me a message. I'd love to chat with you.